Hi, I'm Dr. Anthony, and I want to talk to you today about your sciatica pain and how to get rid of it for good. All right, so if we zoom in here onto our model, we're going to go down to where sciatica stems from. So sciatica comes from the sciatic nerve, which runs under the glute muscle right here. So we have the sciatic nerve that comes from the base of the spine. It runs down under your glute and piriformis muscle, comes down your leg, and into your foot. And so right here represented on the model is these yellow squares. That represents the cause of your sciatica pain, SATs, scar tissue adhesions and trigger points. What that is muscle tissue that's formed incorrectly, causing constriction around the nerve, causing you the nerve pain down your leg or even locally into the lower back and glute area. So you've probably tried things like stretching, massage therapy, physical therapy, other therapies, and they may have given you some relief, or maybe they've worked very well for you. But then you might have had a reoccurrence and you would think to yourself and get frustrated, why is this coming back? It's because you have to permanently get rid of these restrictions in the area and around the nerve, specifically is the sciatic nerve. So acupuncture is one of the most effective therapies into permanently getting rid of your sciatica pain. So what we do to get rid of that, the procedure is we find these SATs, we go in with a tiny, thin, painless needle, and we start to break these up, just tapping, breaking up the scar tissues, adhesions, and trigger points around the sciatic nerve, usually located within the piriformis muscle. We break these up, and now the body is able to send in blood containing all the ingredients to break down these tissues that it couldn't get into before and restore it back to natural muscle fibers and tissue that actually flex and move with range of motion exercises and bring back the natural movement to your body, not causing pain anymore. So you might be wondering, does your lower back pain, is it truly lower back pain or is it truly sciatica? Now, the difference in symptoms with sciatica versus lower back pain, regular lower back pain tends to stay around in the lower area. It can go into the butt region. Lower back pain does not go down your leg usually. It's usually a fixed pain, sharp or stabbing, dull and achy. And sciatica is sharp shooting, stabbing, dull, achy, here usually running down the entire length of the thigh, leg, and sometimes even into the foot. It may possibly come in around the knee also. Some people try and foam roll the ITB area to help their sciatica, and that's not helping them because it's actually stemming from the sciatic nerve coming down. They might have only temporary relief. One of the tests we use to test for sciatica is the straight leg test. So you can do the straight leg test seated, where if you're in a seated position, you actually try and raise your leg up. And if that causes pain and recreates the pain that you're having, that could indicate that you have sciatica. You can also try the straight leg test by laying on your back and locking your knee and bringing your leg up towards your head to about 90 degrees, or as far as you can reach. Not everyone is flexible enough. And if that starts to recreate your pain, you might have sciatica as well. You might try and do these tests at home and aren't sure. You can come into the office and we can do these tests for you to be more accurate. In the meantime, if you're suffering with sciatic pain and lower back pain and you want some home remedies to use, I have my favorite products of home remedies that we use in the office and we send patients home with. So one thing you might be familiar with is pain patches. A lot of different brands, and there's a lot of different ingredients. Some contain natural ingredients. At your pharmacy, they can contain some drugs. These patches contain natural ingredients, but they are different, and some patches might work better than others. Then we have the very popular CBD cream. You want to make sure that you get a CBD cream or oil that has 0 THC, so that way you won't be positive if you're tested. One of my favorite products right now is eucalyptus oil. It's very affordable, and it brings fresh blood to the area and eliminates pain. And then for my homeopathy creams, we have Topricin regular and we have Topricin sports. And that is a great quick pain reliever as well. All these products have different chemicals in them that are natural, and they're all fast pain relievers. So one of them might work better than another. I highly recommend all of them. So you should do what's best for you and your budget. If you have any questions about your pain, any types of conditions, please call the office, ask for Dr. Anthony. I'll get back to you as soon as I can. I can help you recommend which product could be best for you. Please like and subscribe to my channel. Thank you all very much.